sana, buya sana, salolulahlekile, buya salalwam, du sana, du sana, yatyambo yami yenhle.
Like beautiful flowers, many women grow up and bloom in the fullness and beauty of life. Sadly, close to 1 million of these women are cut down prematurely every year. They die in and around the time of pregnancy. And over 8 million babies are born dead or die within the first month of life. Each of these women who died had a community, a family, and a face. Each has a story with lessons to learn. This film is about going beyond the numbers. It is about learning from the faces and the stories of each of these women. It does not have to be this way. Indeed, all over the world, health workers and some governments have started learning lessons from these deaths of women in order to prevent further deaths of women and children. Many lives can be saved by doing maternal death reviews and implementing the recommendations that emanate therefrom.
This is the maternity section of Garissa Provincial General Hospital in a hardship remote area. In this community, a lot of mothers give birth at home, and a lot of mothers do die as a result of delivery without medical care. We have been doing maternal death reviews in the last 1 year, and we hope by doing so we will reduce and we will attract mothers to come and deliver in this facility. After the mother's death in the hospital, one of the things that we try to do is, as much as possible, try and visit the family to offer our condolences and find out the circumstances that led to the death.
يا وحي عدسنيسا إنا مقعادة أشكتو.
إساق ظهر عبد.
يا إسلام تادنا.
مليون دعس أدوار.
He's saying my names are Isaac Dahir and my wife's name Malyoon Deis.
The two nurses from our hospital are talking to Isaac Dahir about the recent death of his late wife, Malyoon.
He can't even have words to explain the impact he got from that death, because she left the kids, because she was supporting him, paying the school fees of the kids. She's been there supporting him at all costs, but now it's nothing, everything. You see, this is somebody who needs to be treasured.
The baby Sumaya survived, the youngest of 6 siblings, in a motherless family. Sadly, another woman named Sahan, aged 19 years, died recently at our hospital.
He was living about 30 kilometers away from the hospital, And most of the time they are very busy with the animals there. And because of the long drought in this part of northeastern province, especially Garissa, they couldn't have the time to come to the hospital for antenatal care. The in-laws have been far away. We couldn't raise the blood. We couldn't get the donors. She had severe anemia. Before the blood transfusion, the patient collapsed.
The deaths of Malyun and Sahan were discussed in our monthly maternal death review meeting.
I said she had a chronic hypertension which was exacerbated in pregnancy. All throughout her pregnancy she was on antihypertensives. She was admitted to the maternity unit through the high-risk clinic. The blood pressure continued to go down until it was unrecordable. And then unfortunately, we lost the patient in theater.
You can imagine your own sister, your own self, we're all women. It could happen to us. I'm looking at the pathogram to see what time, how established was she at that time, because she came with that diagnosis of severe anemia and severe malaria.
This one particularly hit me because I thought it's something that if we worked extra hard, especially if we got blood in time, we would have saved the life of this poor woman.
So let us learn to consult. If you're not sure of anything, ask your colleagues, ask your seniors. Did it teach you anything?
Yeah, it taught me a big lesson. I felt that if this patient had some access to a health facility prenatally during the antenatal care, maybe this anemia would have been corrected prenatally instead of waiting for until that last minute when things came to their worst.
Another thing we have learned is it's so vital to talk to relatives, to talk to the family of these people so that they can understand better. By the way, they have other children. Like I'm sure the mother, the grandmother of this girl has many other children, and she will keep repeating the same mistake over and over again of, refusing transfusion. But if you had just given this mother 1 minute, tell her the importance of transfusing, I'm sure you'd have saved many, not just this woman, you'd have saved many, many more lives.
It's good we have shared so many things in the way of correcting this, and I believe that these things put in practice, we are going to have a good maternity, and we'll have mothers who come in and go out walking with their babies and happy.
Every lady who died had a story, and we had to review that story to ensure that we don't lose mothers.
We would be able to pick what the problems are, and through this, then we'd be able to implement and make a change in the quality of healthcare that we give.
But now, the maternal death reviews were to have action, not just saying and meeting. We'll put in writing that blood, and that was the action we took. The most important thing was awareness in the staffs themselves. In those reviews we did, found a lot of things. We found that we didn't have any record keeping. So now we are aware, and we had to put some new, print some new registers to ensure that we capture accurate information.
Also through the board, we bought them a mobile, and then Danida also through the radio calls has made it easy. When Wajir is bringing a patient, they tell us the kind of a case so that the doctors can be ready, the theater can be prepared to avoid delays.
Now you have seen we have a crash cut box that we ensure we say this is only for emergency. We have renovated the maternity now. It is much more decent than it was before. And even as I talk to you, we have 2 staffs in training now, 2 midwives.
The main things that we have learned from the maternal death review is simple things that you make changes and you make interventions and they work.